Hello and welcome, and thank you for viewing Understanding the Pneumococcal Quality Measures. This presentation is one in a series of videos explaining the current 15 quality measures that comprise the nursing home quality measure domain of the Care Compare Nursing Home 5-star rating system. You may find it helpful to have a copy of the current quality measures user's manual turned to either the long stay or the short stay percent of residents assessed and appropriately given the pneumococcal vaccine quality measure page when viewing this video. The link to that manual is found on the next slide. MDS 3.0 section O is included in this quality measure. This presentation contains information from the MDS 3.0 RAI manual and the MDS 3.0 Quality Measures User Manual, version 14, accessed in February of 2021. This presentation is meant to enhance the understanding of the quality measures discussed during the presentation and is not meant to take the place of or be inclusive of all information and instructions provided by the MDS 3.0 RAI manual and the MDS 3.0 Quality Measures Users Manual. Any updates to both of these manuals will supersede content presented, and the most current manuals should be utilized at all times. The links to the official CMS site providing MDS 3.0 RAI manual and MDS 3.0 Quality Measures materials are provided on this slide. In the Quality Measures Users Manual, there are 4 individual quality measures related to the short stay pneumococcal vaccination and 4 individual quality measures related to long stay pneumococcal vaccination. Every quality measure, or QM, has a CMS and National Quality Forum descriptor, although in this instance, the NQF descriptor has been withdrawn. As an example, this slide is showing the descriptors for the first long stay QM listed in the manual. The following 3 measures are additional breakdowns of this first most complete measure, so we opted to show this one as an example. These quality measures report the percent of long stay residents assessed and appropriately given pneumococcal vaccines in the 12-month reporting period. During this presentation, I will refer to the target assessment. This is the reason for the MDS assessment. The federally required OBRA assessments are completed on admission, quarterly, annually, and with a change in status. An OBRA assessment may also be completed when making a significant correction to a prior MDS assessment. For OBRA assessments, MDS item A0310A is coded as 1, 2, 3, 4, 5, or 6. For Medicare Part A residents, the target assessment is considered for PPS assessments if it is a 5-day scheduled assessment. For PPS assessments, item A0310B is coded as 1. For another reason for a target assessment may be a discharge assessment. The discharge assessments considered for this quality measure are those coded as a 10 or 11 in item A0310F, return not anticipated or return anticipated. Each of the MDS assessments has a target date, also known as the event date of an MDS record. The first type of record is the entry record. The target date for the entry record is the date the resident entered your building. For discharge records, the target date is the date of the resident's discharge. The discharge record is coded as a resident whom you are not expecting to return, or as a resident you are anticipating to return to your facility. Deaths in the facility are also coded as a discharge record. For discharge records, the actual date of discharge is coded in item A2000. For any other assessments, such as OBRA, required admission, quarterly, annual, or significant change in status, or the PPS assessments, the target date is the assessment reference date, otherwise called the ARD. The ARD or target date is the last day of the resident's observation period and is MDS item A2300. For example, if an item on the MDS has a 7-day look-back period, the information collected for the 7-day period will end on the ARD at midnight. For each of these target dates, you will want to make sure that you include anything that occurs on that date up until midnight. For the pneumococcal quality measures that are long stay quality measures, these refer to those pertaining to residents who have been in your facility for 101 days or more by the end of the target period, as we discussed in slide 5. A resident must be in your building for at least 101 days to be included in this long stay measure. A couple of points to keep in mind is that only days within the facility count in the 101 days. So that excludes any time hospitalized or out of the building, say visiting at home. When calculating cumulative days in the facility, or CDIF, the day of entry counts, but the day of discharge does not. However, if a resident is admitted or readmitted on the same day as they are discharged, then the resident is considered as having a one-day stay. For the pneumococcal quality measures that are short stay measures, these are those pertaining to residents who have been in your facility for 100 days or less by the end of the target period that we discussed in slide 5. A resident must be in your facility building for no more than 100 days to be included in these short stay measures. Again, only the days the resident is physically within the facility count in the 100 days. When calculating cumulative days in the facility, or CDIF, the day of entry counts, but the day of discharge does not. However, again, if the resident is admitted or readmitted on the same day as they are discharged, then the resident is considered as having a one-day stay. The pneumococcal quality measure appears on Care Compare and in the CMS data sites as a percentage, a ratio of the numerator divided by the denominator. The numerator is the actual number of residents who were impacted by the quality measure condition during the report period. So with these quality measures, the numerator is the number of residents who were assessed and appropriately given the pneumococcal vaccine. To be included in the short stay or long stay assessed and appropriately given pneumococcal vaccine numerator, the resident's selected target MDS assessment must be coded with any of the following 3 criteria. The first criteria is the resident's MDS at item O0300A, and this is coded as the resident has an up-to-date pneumococcal vaccination. The second criteria is that the resident was offered the pneumococcal vaccine, however, it was declined. Keep in mind, as long as it was offered, the resident has the right to choose not to have it. That is still acceptable to trigger this in the correct way. And the third criteria is that the MDS is coded that the resident is not eligible due to a medical contraindication. For example, an anaphylactic hypersensitivity to components of the vaccine, bone marrow transplant within the past 12 months, or receiving a course of chemotherapy within the past 2 weeks. Additionally, medical contraindications can include a physician's order stating not to immunize. Any of the 3 criteria shown in slides 8, 9, or 10 will populate the quality measure as the resident being assessed and appropriately given the pneumococcal vaccine. This is what we want to see. The denominator is the number of residents potentially impacted by the quality measure condition during the report period. So what is included in that denominator? For the pneumococcal quality measures, this basically includes all residents who have had a stay in your facility with a selected pneumococcal vaccination assessment, either as a long stay resident or a short stay resident, unless they have an exclusion, which we will look at on the next slides. So an exclusion is defined as conditions that exclude a resident from both being counted in the numerator and the denominator. So for these pneumococcal quality measures, what are the exclusions? There are actually no exclusions that apply to the long stay percentage. Excuse me, I got ahead of myself. For the pneumococcal short stay, or SS, quality measure, or actually on the CASPR report, it will just be indicated with an S in parentheses. There is an exclusion, only one, and that is a resident's age on the target date of a selected target assessment is less than 5 years. In other words, the resident has not yet reached his or her 5th birthday on that target date. For the long stay pneumococcal measures, there are no exclusions. The MDS 3.0 RAI manual provides guidelines from the CDC regarding pneumococcal vaccine administration. So we urge you to take a look at that while you're preparing for the time of year when you're going to be doing these vaccinations, and along with any time that you're admitting residents and checking the records. If a resident has received one or more pneumococcal vaccinations and it is indicated to get an additional pneumococcal vaccination, but it is not yet eligible for that individual to get their next vaccination because the recommended time interval between vaccines has not lapsed, then we still can code O0300A as being one or yes, indicating that the resident's pneumococcal vaccination is up to date. Even though it is recommended that an individual receive the Prevnar 13 first, there are incidents when the Pneumovax 23 was administered first. If a resident has received either the Prevnar 13 or the Pneumovax 23, and it has been less than a year, code the vaccination status as up to date. If the resident has received either the Prevnar 13 or the Pneumovax 23, and a year or more has passed, see the links that are specific guidance about pneumococcal vaccine recommendations and timing in the MDS RAI 3.0 manual. There are additional MDS coding examples provided in the manual, and I'd like to bring your attention to one instance in particular, and that is an example provided that indicates when a physician writes an order that a resident should not be immunized, the MDS should be coded at O0300B as ineligible due to a medical contraindication. The short stay and long stay percent of residents assessed and appropriately given the pneumococcal vaccine is not provided on your CASPR report. It does appear on Care Compare and is viewable by the public. You can view the data that CMS has pulled from MDS reports and uses to populate Care Compare. You can also keep a log of immunization status of residents residing in your nursing home, estimating the numerator and denominator to stay on top of this quality measure, and we provided a link to a sample tool on the slide. The pneumococcal quality measures are ones that we do have control over. Striving to know the vaccination status of all residents is important for the health and well-being of your entire community. Make vaccination assessment part of your admission process. Ask the resident or their family if the vaccine was received. Request immunization records from primary care providers and transferring facilities. The HIPAA eligibility transaction system includes immunizations that have been billed. You can ask your billing department about this resource. Also, check your state's state immunization information system website to see if there is a record of immunizations available. There are several resources, aim to assess and appropriately give the pneumococcal vaccine to 100% of your residents. As I stated previously, this is a quality measure that nursing homes have complete control over. The QM is looking for whether the resident was assessed and then appropriately given the immunization. The QM percentage will be positively impacted if the resident received the immunization in your facility or in any other facility or setting. The QM will not be negatively impacted if the resident declines the vaccination, as long as your staff has provided appropriate education and offered the individual the vaccination. If they say no, that is okay. That is their right, and that means that this is appropriate. Additionally, if the resident cannot have the vaccination due to a medical contraindication such as an allergy or allergy or history of Guillain-Barré syndrome, that is considered appropriate and so does not negatively impact the quality measure. The first GP Quinn tip sheet on this list of tools provides the details that offer all the acceptable responses to the pneumococcal MDS elements, those that will not negatively impact the quality measure. We've also provided a worksheet for tracking individual resident vaccinations, as well as a tracking log for vaccinations given within your facility to help you stay on top of this process at the systems level. There are several resources that you can access to assist you with this when working on the quality measure. We've provided the State Operations Manual link for review of rules and regulations related to immunizations and to be aware of what the surveyors are looking for. In addition, the CMS policy and memos can provide documentation of any changes to the regulations. Percent of residents assessed and appropriately given the pneumococcal vaccine is a publicly reported quality measure on the CMS Care Compare website, formerly Nursing Home Compare. Use this website to view what consumers see regarding your nursing home and the quality measures. In addition, you can see how your nursing home compares with nursing homes in your city, region, state, and nationally. Take a look at the CDC pneumococcal ACIP vaccine recommendations webpage for current guidelines. The Great Plains Quinn QIO Nursing Home webpage also provides lots of tools and resources, as well as links to past training events. And finally, please contact your state's Great Plains Quinn Nursing Home contact for more information or technical assistance concerning the pneumococcal QMs or any of the other nursing home quality measures. Thank you for taking the time to learn more about the short stay and long stay percent of residents assessed and appropriately given the pneumococcal vaccine quality measure, and for all you do in providing care for the residents in your community.